Bismillahirrahmanirrahim. Assalamu alaikum. Good afternoon and a warm welcome to you. It's just gone past 5:30. We are live here from CVFM radio studio. My name is Idrees Rashid. Keep me company on this community connection. Hope you guys are well wherever you are, wherever you're watching. Thank you for tuning in. And you've just probably heard the notifications going off. What I want to do is to share this particular live if you're watching on any of the community pages or the Facebook Live page as well. Today's program is all about COVID-19, coronavirus vaccination, the community response, and what is happening locally. We are working with the Primary Care Trust, the NHS locally, and some excellent work that is going on from some doctors from the Muslim community, but also working with the wider community to ensure that if there is any vaccine hesitancy, we provide that information, accurate information to overcome any fears. You've probably seen some of the videos that we've been posting on our page from various community leaders. We've had some videos sent in from the Sikh community, from the Pakistani community. We've had Brother Muhammad Asif, who is the chair of the Al Mustafa Center. He's been in at the mass vaccination center a few weeks ago to have his COVID vaccination. So we're trying to get as many different members of the community to talk to you directly, to share your experience about COVID. But it's my pleasure to introduce Dr. Yusuf Soni, who is one of the lead clinicians with the primary care networks here in the Tees Valley area. I'd like to welcome him on to the program. Assalamu alaikum, Dr. Saab. How are you this afternoon?
Wa alaikum assalam wa rahmatullahi wa barakatuh, and Bismillahirrahmanirrahim. Alhamdulillah, I'm very good. Thank you, and thank you for inviting me on this platform to bust some of the myths that might prevail and preventing people from getting vaccination. I think it is very important, as you rightly said in your introduction, that we are seeing the cases going down, the deaths have constantly going down, and I think I've just watched the Prime Minister's update, and there's only about 26 deaths, which is for far too many anyway. But I think, alhamdulillah, the numbers are really going down, and I think that's probably down to the excellent vaccination campaign that UK have managed through to roll out, and I think that is one of the reasons why we have done so well with regards to curtail the numbers and decreasing the death.
Okay, we also have one of our community champions with us, Muhammad Riyaz Saab, a well-known figure within the local community. And Assalamu alaikum, Muhammad Riyaz Saab. How are you today? Welcome to you as well.
Thank you, Idrees, for inviting myself and Dr. Yusuf Soni to your program. And inshallah, we're hoping that in the next few days, the community will support the initiative. And on Tuesday and Wednesday, inshallah, we'll be at Mosques Stockton. And on Thursday, we'll be, inshallah, at Al Mustafa Center. So we are hoping that the Stockton and Middlesbrough community and the wider community, the Tees Valley, will come and support this and have the vaccination sorted, inshallah.
Definitely, we will come on to the vaccination, but I would like to while we have Dr. Soni here, Dr. Saab, there has been some vaccine sort of hesitancy within the South Asian community, particularly. What's your message to our viewers, our listeners today, in terms of the reason that they should be vaccinated?
I think the most important one is protecting yourself and your loved ones, because not only are you going to build up some immunity by means of this vaccination, but also you are going to be increasing the herd immunity, which is the immunity that increases if lots of people have an immunity against the virus. It stops the spread and also the severity. So I think two important reasons. One, if you did get COVID, and if you have already had vaccination, so your immunity is boosted up, then the amount of hospitalization, I think, has gone down by 80% from the preliminary studies that we are seeing. And also the symptomatic relief that patients are getting is probably only they're getting about 60% benefit. So I think to protect yourself, to get less symptoms so that you can recover quickly, and also to protect the wider community, vaccination is the must.
Dr. Sam, you have been instrumental in terms of making these community clinics happen. Well, what's your primary thinking behind bringing out the vaccinations to community settings like the masjids? As Dr. Mohammed Riyad Sab earlier on alluded to, we have got 3 days of community vaccination drop-in clinics. We'll share those details in a moment. But what's the rationale behind that?
So I think what we wanted to do was, there's lots of miscommunication through social media that has gone on, and the commonest questions that I often get asked by my South Asian population is the misnomers or the myths about the vaccination, and I just wanted to bring it to the heart of the community. And I think the Muslim community has been, in terms of uptake of the vaccines, Muslim community has lagged behind. So we wanted to involve the local imams, and alhamdulillah, we have had lots of support from everybody, and they are all clear that the vaccination should be carried out. But I think it's the social media misnomer. So we wanted to create a face through the local leaders and give a very strong statement, and get and bust the myth, basically, in terms of, so lots of questions about infertility. Is it halal or haram? Is there any animal product? There is no animal products in any of this vaccination, and they have all been certified, and all. So I think there are lots of imams going to be vaccinated.
Yes, indeed. I think we had a previous session on here in relation to some of the myths around the vaccinations. Our community are quite aware, but there has been fatwas that have been given by eminent imams and scholars within the United Kingdom in relation to the vaccination. So there is no doubt about that. But in terms of the community effort, I want to bring Mohammed Riyad Sab into the conversation as well. Obviously, Riyad Sab, you played quite a proactive role in terms of making this happen from a community perspective. Tell me how and what sort of reaction you've had from the masjids in the local area in terms of supporting Dr. Soni and his team.
Well, roughly about 7 weeks ago, Dr. Soni asked me if we could organize something within the mosque. And it's taken roughly about 7 weeks to organize this, and Dr. Saab has been, very instrumental in doing it. And I approached the community, and shukr alhamdulillah, they were very responsive. And then last week, the medical team, including Dr. Soni, visited the 2 sites in Middlesbrough and Stockton, and they approved the 2 sites. Obviously, there's going to be different women's section and different men's section, so women are more than welcome, and they will have the separate area for that, and we've taken good care of everything, shukr alhamdulillah. And I think it's going, we just need the community support in getting as many people as possible out to these 3 days events, and not just protecting themselves, but they're also protecting the community and their own families.
So talking about community support, and one of the venues is the Al Mustafa Center. I do have the pleasure of having Brother Muhammad Asif in the studio as well. Assalamu alaikum, Haji Saab, how are you?
Wa alaikum assalam wa rahmatullahi wa barakatuh. I'm fine. How are you?
Now, it's so nice for you to join us as well. I've got Dr. Yusuf Soni on in the studio as well, virtually, and Mohammed Riyad Saab. So,
to all.
Okay. Mohammed Asif, tell us a little bit about why Al Mustafa Center decided to support this particular campaign and what you're hoping it will achieve.
I think, it is a very good opportunity for a whole Muslim community, especially to come in Al Mustafa Center. And especially, I haven't heard your guests before, but my thoughts are like it gives us opportunity. Especially, I will congratulate Dr. Yusuf Saab, who's put all his efforts as a Muslim to select a Muslim community center, which we have a choice. Sometimes we go in the centers, and our ladies especially don't have a choice of parda, or don't have a choice of a female vaccinator. So, I mean, as we discussed the other day, they are providing all these facilities for especially Muslim ladies, which is very satisfying for the Muslim community, and they are very happy. I've talked to a lot of people, and they said this is a really good thing you are doing, and it's a good opportunity. A lot of people were hesitating to come forward, and a lot of people contacted me, and they said they're going to come on Thursday, and especially the ladies. They had all of the concerns as well. Inshallah, we'll discuss about that as well. But we have a pleasure to provide Al Mustafa Center for this program, and we are really happy, like we're serving the community.
Jazakallah. So, Dr. Soni from Brother Asif, he's saying that the community have been very receptive in terms of the initiative. Obviously, we've got Ramadan coming up, and generally there isn't anything preventing people getting vaccinated. But when you're fasting, and I know some people do have some sort of slight temperature and so on, so people might be a bit reluctant to go during Ramadan to get vaccinated. So this is a great opportunity to have it done prior.
I think, and I must congratulate, and also the pharmacy support that we had, and I think also the Public Health England and the local councillors, the mayor, everybody has been quite instrumental in terms of getting this all organized. Usually in NHS, we talk about months before anything like this pop-up clinics would get permission, but alhamdulillah, we have managed that in a very short span. And Dr. Riyaz Saab, Asif Saab, and the Farooq Azam Mosque have been very, very supportive, and not to mention you, Idrees Saab, would be this favor, but you have been quite instrumental in promoting this. So thank you, everybody, and may Allah bless you all.
No, it's a team effort, and I am a little bit concerned because I've seen some of the stats in terms of the uptake of the vaccination, and I think anything we can do from a community perspective will help towards that. And I know there's multiple barriers people have in terms of accessing the vaccination, so anything we can do to reduce some of those barriers or to bring some of those barriers down. And Brother Asif talked about female vaccinators, the location, access to IT, because people in terms of IT literacy, people are not able to book the appointments online. So there's small things that build up to become a bigger hurdle. So I think this is a great initiative, and we are requesting the community to come out and support it. So Dr. Riyasa, would you like to share the details in terms of, we've got 3 days, would you like to share the details in terms of when and where people can come? And then we'll go on to Dr. Yusuf in terms of who are the target audience.
Yeah, thank you, Idrees. Tomorrow and Wednesday, inshallah, from 9:30 a.m. to 5:30 p.m. with a break from 1:45 to 2:45 for namaz and lunch for the staff. And the same will apply on Wednesdays as well at Farooq Azam, Stockton on Tees. And then on Thursday, inshallah, we'll be at the Al Mustafa Center from 9:30 to 5:30 p.m. with a lunch break at 1:45 to 2:45, inshallah. But those who can't actually make it to Middlesbrough, they are more than welcome to come to Stockton or vice versa. And as long as you bring some form of ID with you, that would help us to trace you on the system. So please come and bring your ID with you. But you can come to any center any day. There's no appointment necessary, Tuesday, Wednesday, or Thursday. And you're more than welcome to come and bring your family along. Bring, anybody over the age of 50 that hasn't actually had their first vaccination. And secondly, those between the ages of 18 and 50 with underlying conditions, i.e., diabetic or cancer or kidney problems or anything of that nature, they are
So
also invited.
great, great. I was going to bring Dr. Soni in relation to the target audience. Obviously, people have been getting invitations directly from the NHS. Some people have taken up those opportunities. Others might have not had for various reasons. So, who is the primary target audience? And Dr. Riaz mentioned underlying health conditions. So, would you like to maybe elaborate on that a little bit?
Yeah. So anybody over the age of 50, they can just walk in and we will vaccinate them. Anybody between 18 and 50 who have underlying conditions such as diabetes, dementia, if they have a heart problem, if they have COPD, asthma, kidney issues, any kind of liver problems, any lower immunity. So if they are taking any kind of disease modifying drugs which will lower their immunity, they can come in. If they have had a stroke before, any kind of a neurological problems, if they have learning difficulties, then or are overweight, then they can all come. But also importantly, within the Muslim community as well, if you are a carer for somebody who is in high risk, please do come and we will vaccinate you, because even though you are not getting a carer allowance, sometimes that could be an issue. So if you are looking after somebody, do come in. And also the asylum seekers and the refugees, that is covered within the 6 cohort group, so they can just walk in as well.
Yeah, that was going to be my other question, because I've had a number of questions, a number of people contact in relation to carers. And, you know, within especially the Muslim community and South Asian community, we do have a joint family structure where, you know, the parents or grandparents live with the family, and they might have some serious health conditions, but the carers aren't registered, so they might not consider themselves as carers as well. But it's important that they are vaccinated as well, and so the opportunity is open to them as well. We've had 2 or 3 people that commented.
Absolutely. Absolutely. I think we need to be opportunistic, and that's what the national steering is as well, that we need to be quite opportunistic in protecting those people by protecting their carers, whether if they're unpaid carers. And I think nationally it is being recognized that that is the case in some communities, and particularly in Muslim community, as you rightly said. But also the asylum seekers and the refugees. So I think we need to get that message out, and anybody can come in within those groups and we will vaccinate them. So it's not exclusively only for the Muslims. I think it's open to everybody who wants and wants to come in, and inshallah we will vaccinate them.
So in terms of the asylum seeker and refugee population, those age stipulations still apply as well?
So no, so as long as they are over 18, we can vaccinate them. So it doesn't have to be over 50 without any, as long as they are over 18 and are asylum seeker or refugees, we can vaccinate them.
Okay, so I'm just going to come to Brother Muhammad Asif for a moment. And अजी साहब, हमारे सामीन के लिए आप अपनी मस्जिद की तरफ से थोड़ा पैगाम दें, क्योंकि आपकी जो कांग्रेगेशन मेंबर्स हैं, जो अल मुस्तफ़ा सेंटर नमाज पढ़ने जाते हैं, जुमा पढ़ते हैं, उनकी फैमिलीज के लिए क्या मैसेज आप देना चाहते हैं?
उनकी फैमिलीज के लिए यही मैसेज है, जिस तरह अभी डॉक्टर साहब ने बताया है कि आप जो है वो एवरीबॉडी इज वेलकम एज लॉन्ग एज आपको जो है ये 50 साल से ऊपर की आपकी उम्र है तो आप आ सकते हैं। उसके अलावा भी 18 साल से 50 साल की उम्र तक अगर आप के साथ कोई अंडरलाइंग प्रॉब्लम है, जिस तरह के कोई डायबिटीज़ है या किडनी प्रॉब्लम है, जिस तरह डॉक्टर साहब ने जो है ये लॉन्ग टर्म इलनेसेस जो हैं, अगर वो आपको हैं तो आप जो है वो मस्जिद में आ सकते हैं और वैक्सीनेट करा सकते हैं। और उसके अलावा मुझे ये जो सवाल इसका जवाब जो मिल गया है, बहुत सारे लोगों ने मुझे पूछा है कि बहुत सारे बच्चे हैं उनके जो कि 20-22 साल के हैं, 24 साल के हैं, और वो स्पेशल नीड हैं, और जो है वो उनको जो है वो हम जो है वो लेके आते हैं या नहीं। डॉक्टर साहब ने भी जवाब है कि वो जो बच्चे हो सकते हैं। इसके अलावा जो असाइलम सीकर हैं वो भी आ सकते हैं, और वो लोग जो कि, और एक सवाल जो है वो मैं भी पूछना चाहूँगा डॉक्टर साहब से कि ये जो लोग, ख़ास तौर पे हमारा फैमिली सिस्टम ऐसा है कि लोग जो है वो वालिदैन के साथ रहते हैं, जो वालिदैन है 50-60 साल की उम्र है उनकी, और वो जो है उनको डायबिटीज़ है या इस तरह की बीमारियां बहुत सारी हैं हमारी फैमिलीज़ में, तो वो अगर उनके साथ रह रहे हैं लेकिन वो 50 से कम हैं, तो क्या वो भी कैरियर के अंदर आ सकते हैं? क्या वो इस तरह साथ रहते हुए वो आके जो है वो भी लगवा सकते हैं टीका, या नहीं लगवा सकते?
जी, बिल्कुल, बिल्कुल वो आ सकते हैं, और इंशाल्लाह उनको, अगर वो ऑब्वियसली जॉइंट फैमिली में है और अपने वालिदैन का ख्याल रख रहे हैं और वालिदैन हाई रिस्क कैटेगरीज में हैं, तो इट मेक्स क्लिनिकल सेंस कि उनको हम प्रोटेक्ट करें, और नेशनल ड्राइव भी वही है। तो इंशाल्लाह उनको आके आप हम वी विल सजेस्ट दैट दे शुड कम and get vaccinated. Bring some form of ID. Just a caveat I would say is that just anybody who comes, it's the first dose. We will organize the second dose, inshallah. But also, they should, if anybody is COVID positive, they need to be at least 4 weeks after the positive tests. So they shouldn't be positive in the last 4 weeks when they come to us, and that we can vaccinate them.
डॉक्टर साहब एक और सवाल था, that was in relation to the second job. So कुछ हजरात वो भी हैं जिन्होंने they've already had the vaccination and they were asking, is it can we come as well to receive the second vaccination? So what's your answer to that particular question that was sent in a few times over the last few days?
Yeah, I've been asked a few times as well, but no, unfortunately, we won't be able to vaccinate them for the second dose. I think the primary, what we are trying to do is to spread the immunity by giving the first dose to people who haven't had enough of vaccination. So we won't be able to give second dose, but the people that we vaccinate on the day, we will plan for the second dose, inshallah, in 10 to 12 weeks time. And
I would
again,
like
that
to
probably
ask-
would be in mosque again.
So yeah, so there will be arrangements in place to have the second vaccination. Sorry, brother Asif, I'm going to let you come in
brother
now.
Idrees, sorry, I just wanted to ask that, Dr. Saab, a lot of people, actually a couple of sisters have been in touch with Mosque, and they said which vaccination, because there's there is a rumors going about AstraZeneca and others, and they said which make is going to be done tomorrow. So people ask these questions. So I don't know if you have answer for that or not. I thought I'll put that to you, and if you can answer that.
So it would be AstraZeneca that we will be vaccinating, because it's much stable and we can move it within the community very easily. Pfizer is a very difficult vaccination to move out from the local vaccination hubs. So that's why we would be doing it. And what I would suggest to anybody who is listening, please do come and get vaccinated. AstraZeneca has brilliant evidence behind it. MHRA and the European community, they both have said that there's all these rumors about AstraZeneca. It doesn't equate, and the amount of protection it gives is much better than not to have it, basically. So I would really encourage that my brothers and sisters, that they should come get vaccinated, protect yourself, protect your family before Ramadan starts,
Inshallah.
Inshallah. So thank you so much, gentlemen, for your time today. I just want to encourage anyone that is watching, listening, please do share this video broadcast as well with your family and friends. Encourage people to attend. We have 3 drop-in sessions, as Dr. Riaz earlier on mentioned. Tuesday and Wednesday, we are going to be at the Farooq Azam Mosque, which is on Borsfield Lane, Stockton on Tees. We'll put all the addresses and postcodes. You probably know where those masjids are, but if you're not familiar with them, we'll put the details within the text of this particular broadcast. So Tuesday and Wednesday in Stockton. Thursday will be at the Al Mustafa Centre, which is the top end of Parliament Road in Middlesbrough. As Brother Muhammad Asif said, there will be intizam for ladies as well, sisters, separate arrangements. So, Brother Asif?
Yes, that is very important, and a lot of people were asking about that, and they are very happy about it. और मैं यही कहूँगा कि आप जो है वो स्पेशली हमारी जो सिस्टर्स हैं उनके लिए अलहदा पर्दे का इंतज़ाम है। आप जो है वहाँ पे आएँ और पर्दे में जो है वो आप जो है वो अपना टीका लगवाएँ और फिर आप जो वहाँ से जा सकते हैं। तो वन वे इन सिस्टम भी है और इंशाल्लाह हमारी इंतज़ामिया के लोग भी वहाँ पे मौजूद होंगे और इंशाल्लाह बड़ा ही ईज़ी हमने कोशिश की है कि ईज़ी आप इजीली आ सकें वेरी कंफर्टेबली एंड आप गेट द जॉब डन एंड देन जस्ट गो होम। सो आप जो है वो ज़रूर आएँ और ये सबसे बड़ा जो एडवांटेज है वो ये भी है कि अपने वक़्त में आएँ, कोई अपॉइंटमेंट की ज़रूरत नहीं है। कई दफ़ा इंसान जो है वो अपॉइंटमेंट हो तो सब बहुत सारे काम छोड़ के जो है अपॉइंटमेंट के लिए आना पड़ता है। तो आप दिन के किसी टाइम भी अगर आपको मौका मिले तो सुबह 9:30 बजे से शाम 5:30 बजे तक जो है अगर आप ब्रेक टाइम भी आएँगे तो ज़रूर आएँ, मस्जिद है, नमाज़ पढ़ें पहले और फिर इंशाल्लाह उस वक़्त तक जो है ब्रेक भी ख़त्म हो जाएगी तो आप जो है वहाँ पे इंजेक्शन लगवा सकते हैं।
Jazakallah. And I'm just going to give one final opportunity to Muhammad Riyad Saab to, and especially for the audience in Stockton area as well, because as a resident of Stockton, I think you have a big affiliation to that community, and mashallah, you do lots of good work within in those communities. So, what's your message to everyone in Stockton, especially?
Just like all the brothers have said, come and support this initiative in the mosque and help yourself and all your, not just yourself, but also your family, the community, the country as a whole, because people work in different areas and get this vaccination done. I've had the vaccination 7 weeks ago, and shukran alhamdulillah, no side effects. And I definitely recommend it to all my brothers and sisters at Farooq Azam. As you know, Farooq Azam Mosque is a purpose-built mosque, and on the ground floor, inshallah, there will be intizam for separate for the ladies, separate section for the ladies. And rest assured, all the ladies will have ladies, nurses and doctors looking after them. On the men's side, you may have men's and ladies, but on the ladies' side, specifically, Dr. Sonia sort of made this arrangement, and that only ladies will deal with the ladies. So there isn't a problem. There will be, separate sort of desks there and everything, and so they can come in parda and leave, and there shouldn't be any problem. So
Thank you.
please, I urge all the community to attend these sessions if you haven't already had the injection done. So look forward to seeing you tomorrow, inshallah.
Thank you. And Dr. Yusuf Soni, one last opportunity to firstly thank all the local team here, because I think it's a team effort, and we will welcome them for the 3 days here within the community. So particularly the clinical commissioning group, the NHS, and obviously the teams within the local authority, both Stockton and Middlesbrough councils as well.
Yeah. And Dr. Vaishali Nanda from Middlesbrough PCN as well. I think she has been quite instrumental in providing all the staffing and things. So a very big thank you to her as well.
Definitely. So, guys, thank you for watching. Thank you for sharing. G?
It's snowing.
Is it snowing?
Yeah.
Okay.
We're all right in Stockton. It's very sunny.
Well, it's sunny here as well and snowing as well, so it's double S.
Okay. So, I'm sure the heating does work in both of the centers, so you'll be nice and cozy. So do attend tomorrow, and a big thank you to my guests today for being part and parcel of this short community broadcast. This was Community Connections. My name is Idrees. Keep me company today was Dr. Yusuf Soni, Dr. Muhammad Riyad Saab, and also Brother Muhammad Asif from the Al Mustafa Center. Assalamu alaikum. For now, Allah Hafiz.